Today we're going to talk about parvovirus, which a lot of people have heard a lot about, but they don't know much about. And it's probably one of the most devastating diseases in veterinary medicine. Anybody who has dogs, particularly puppies, have that period where they go through that they are worried that their puppy might get parvo and die. It's a virus, affects dogs. And typically it affects younger dogs. Anywhere from 6 weeks to 6 months is the most common period of time that dogs are susceptible. But we've treated a lot of dogs at 9 months, even 18 months old. Older dogs typically don't get it because they've developed immunity through exposure or vaccination or whatever. It seems to be mainly a disease of puppies. It is very devastating. Causes severe vomiting and diarrhea typically. The diarrhea is typically very bloody. This is what typically kills the dog. Dehydration, shock, the damage to the intestinal tract. They get secondary bacterial infections from all the nasties in the gut. They go into shock and die. They can also, later on, if they do survive, have problems with their heart from damage from the virus to the heart. But that's not as severe a problem as the intestinal form. Generally, if we can get them to live, we're doing pretty well. The mortality rate, that is the number of animals that die from the disease, is around 30% of those infected, which is pretty good. You know, a lot of people think that, oh, if they get parvo, they're going to die. You know, there's no hope. There is hope. Typically, I tell people that the older the puppy, the greater the chance of survival, simply because they're stronger, have a better immune system. If they've been vaccinated even once, their chances of survival increase tremendously. And you might say, well, if they're vaccinated, they shouldn't get the disease. No vaccine is 100%. Plus, it takes time for the vaccine to work. Also, some animals do not respond as well to the vaccine as others. But generally, I find if a dog is vaccinated, the more doses they've had, the greater their chance of survival should they get parvo. I tell people the vaccine decreases their chances of getting it, and if they do get it, it increases their chances of survival. Typically, we tell people that they need to vaccinate their puppies at weaning, around 6 weeks of age, 9 weeks, and 12 weeks. Sometimes if it's a particular breed, such as Rottweilers or Pit Bulldogs, we may suggest they get an additional vaccination. Rottweilers and Pits, German Shepherds, and in my experience, Beagles tend to be some breeds that tend to get the disease more than others, but any breed of dog is susceptible. They get it through contamination from feces of other dogs that have it. The dog that may have it does not necessarily have to be showing symptoms to still be spreading the virus. That's why I tell people, when you have a young puppy, don't take it out around a bunch of other dogs until it's had 2 or 3 vaccinations at least. Okay. Once they get the disease, usually symptoms will start to occur around 7 to 14 days after they're infected. Typically, the first sign we see is they just go off their feed. They lose their appetite, they get a little mopey. Typically, they'll start vomiting. Animals brought into us, a lot of times they're not having any diarrhea, but when we take a stool sample, out comes bloody diarrhea. And then we can test. There is an in-house laboratory test that we can do to confirm parvo, because other diseases can mimic parvo. There are certain bacterial diseases, some other viral diseases, so you want to know for sure that that's what you're dealing with. Now, to treat parvo, there is no cure since it is a virus, and just like the common cold, AIDS, and so forth, there's no cure. You treat the symptoms and try to help the animal fight it off themselves. Typically, the course of treatment consists of medication to prevent the vomiting, because as you know in yourself, if you're constantly vomiting, you just feel terrible, and after a while, you're just going to lose any incentive to get well. IV fluids is without a doubt the most important factor. You must reverse the dehydration from that bloody diarrhea and the vomiting. Sometimes we'll also, in severe cases, we will give IV antibiotics to help fight off any secondary bacterial infections from bacteria in the gut that are sneaking in through the damage in the gut into the bloodstream. The course of treatment in our practice has gone anywhere from 24 hours to 7 days. We have had some dogs that tested positive and were well within 24 hours. That's rare, but it does happen. My feeling was that they were probably already on the mend by the time the owner noticed the symptoms or whatever. Now, some people will say, well, I know so-and-so and he treated Parvo at home. Yes, that is possible if finances are a problem. We tell people that the best thing to do is try to control the vomiting. You can use things like Benadryl, or we can prescribe something a little stronger to control the vomiting, and then rehydrate them orally with things like Pedialyte or Gatorade. Persistence is the key. Don't let up. Our policy here is once the animal starts perking up, stops vomiting, and is able to hold food and water, we get them out of here. We don't want to keep them any longer than we have to. The good news is once they've gotten Parvo and recovered from it, they're pretty well immune to it. You can continue to vaccinate simply because most of the vaccines have other things in them, distemper, hepatitis, and so forth, that you want to protect against too. But it's not a bad idea to go ahead and include the Parvo in that portion too. Parvo, a lot of people say, well, where did Parvo come from? I don't remember that when I was a kid. Well, it first popped up in the United States around the late 1970s, and we had nothing for it. We had no vaccinations. We didn't even know where it came from. The theory is that it was a virus that mutated from foxes, coyotes, that sort of thing, and eventually got into the domestic dog population. As time went on, we got more vaccines. We have better vaccines now. They're very effective. But as I always like to tell people, as with any other drug, it's only good if you use it. If you don't vaccinate, you're taking a chance. And there's just no reason for a dog not to be vaccinated for Parvo. A mistake that I see a lot of people make is they will have a dog that's 6 months old and they'll come in and want their first Parvo shot. Well, why didn't you come in there? Well, I thought they were too young. Call and ask. They need to be vaccinated as soon as they're weaned, and then they get booster shots. That is very important to have those boosters. Just one shot typically is not completely protective. The take-home message that I'm trying to get across is that Parvo is, of course, serious, but with luck and persistence, there is a chance that your dog will survive. Don't give up. That's one of the things that I try to get across to people. They'll have a puppy come in. The puppy looks pretty good, obviously sick, but still looks pretty good. And I try to convince them, hey, let's give them a chance. There is a chance that this puppy will survive. And sometimes we're right, sometimes we're wrong, but it is possible. And the main thing is vaccinate, protect, and if you have any questions, call and ask. Good day.